Dr. Anil Jaisingh, it seems to me that you have done something that no other country has done. What is Sri Lanka's magic formula?
Yeah, thank you very much for inviting. They're saying that early bird catches the worm. And we are one of the flagship holders in this business. And also we have put into practice a very strong control system from the very beginning. Actually, it was 23rd January, only we established the National Action Committee against COVID-19. And basically, the reasons for strong control were a strong public health system, which is time-tested and proven again and again. And then strong political leadership, no-nonsense approach when it comes to actions. And we launched, employed the strong quarantine measures.
Dr. Jaisingh, did you have a long lockdown? Did you have an extended lockdown?
Yes, several months actually lockdown under curfew, right? Entire country. And then thereafter, of course, it was lifted, and there was night curfew for some time. And actually, right now, we have no restrictions whatsoever.
So you're saying the secret is that you started early. Am I correct? That you all started early. You started planning in January.
Early, and then we took strong measures, right. And we have very strong the Quarantine and Disease Prevention Act, which was enacted way now in 1897.
Okay.
And the lockdown quarantine measures all were taken. Using this ordinance, the powers were vested with the Director General of Health Services.
Let me try and go to each of you and get time right at the outset. Just get preliminary remarks. Sri Lanka, as I said, outlier. We have been told they started early, preparing early. Let me turn to Pakistan for a moment, because Pakistan is again a country which, at least in terms of figures, seems to be doing remarkably. You seem to be at the moment adding active cases just 5,936. Now there are two views to this, Dr. Zafar Mirza. One, that the Pakistani authorities are not coming out with the full picture of COVID. The other is, as the WHO says, you are a bit of an outlier. What have you done? What has Pakistan done right? Okay, we'll try and get the audio back to our guests from Pakistan. We are struggling with the audio there. Let me turn to Bangladesh for a moment. Professor Mamun Al-Mehtab, Bangladesh still 90,660 active cases. How successful or otherwise have you been? 4 months ago when we spoke, you seemed reasonably in control of the situation. Is the situation under control at the moment, sir?
It is yes and no. Yes, in the sense that, see, in March, April, it was predicted that around 2 million Bangladeshis will die from COVID, and that there will be extreme scarcity of ventilator beds, and people will be... and that people will be having problems with, hospital beds, etc., etc. But as of today, as we see, as I talk to you, around 70% COVID-dedicated beds of the country remain vacant. And also, we see that the COVID ICUs are available, unlike in many countries in the region and beyond. And the mortality from COVID in this country now varies from 1.2 to 1.3% roughly, which is also in the lower side compared to anywhere in the world.
Okay.
But if you see the reported number of cases, it is true that we had seen a decline over the last few weeks. It was steady for between 20 to 25% in the first for the last several months, at least 2 months. But for the last few weeks, we are seeing it declined to 15%, 14-15%. So it is a bit of relief, but we cannot say that we have controlled it yet, because we all know that if it is more than 5%, we cannot be satisfied or we cannot relax.